Hello, everyone, and welcome back to Life Trek. Thank you so much for joining the Soul Sisters on episode 2 of The Myth and the Reality of Superwomen.
Hello.
So, in the last episode, we spoke about Superwomen and we were joined by Dr. Sushmita Mishra as she spoke about the origin and evolution of Superwomen. Dr. Mishra continues to be with us as we delve deeper into this topic. So, now we can continue with Dr. Mishra.
Yeah. And today we continue the discussion by starting from where we left off in the previous episode. But first, Dr. Mishra, thank you for staying with us. I know you have a busy schedule and we really appreciate you taking the time out to speak with us on this topic that's so close to our hearts. Thank you.
Thank you so much.
Thank
I would like to know what should someone do if they feel constantly responsible for everyone?
Uh, See, it's the level of awareness a person has, a woman has about herself. So it's many times it happens that after suffering too much, a female decides no, it's too much, and this is the time I have to put the foot down. So first step is self-realization, where it person realizes it's too much, and then she can discuss with the family members. If family members are not supporting, she can go outside for counseling, for psychotherapy, to doctors, I mean psychiatrist, or if she's suffering from physical illness, she can go to medical doctors and all. So it starts, if a person wants to change, like I said, that it starts with self awareness. But but it comes very late, when suppose there's already a physical illness or mental illness has developed. That's what we have seen clinically.
So, is there any way like partners or families they recognize the invisible emotional work of this kind of
Many
person?
times it is being maintained by the family and the spouse. See, it is many times maintained by them.
Right.
So, but however, if they say that if it is a physical, when they see the person is suffering because of some kind of illness, that's when, there are times when spouse does, and they can do it because their ego, those who have this syndrome, their ego is very, very fragile. So if they say that I want to help, they'll how they will say and all. So they have to do it very subtly, where they are just taking out some of the and just saying that I'm not helping, but I want to do it. Like that, they can do it, or they can ask the person to let's go and discuss with somebody, and then how I can help you, or uh, so spouse can definitely help, and they many times they do, but they do at the stage when they have already developed an illness. That's what we have seen in the clinical setup.
So, then, and I have experienced this. I have seen this in so many women all around me. But I would like to know, why is asking for help emotionally difficult for many women? You spoke about the ego, that's why I'm asking this. And how can we encourage women to ask for support without actually feeling weak? What do you think?
No, it is again a kind of inborn thing, where asking for help is, the child has taken it into her mind that asking for help is like failure while growing up. So asking for help is kind of thing, and that's where we work on. We work with their psyche, where we take up all these wrong, erroneous beliefs. We work on that. That asking for help doesn't mean that you are a failure. In fact, asking for help is something where you say that these certain things I cannot do, and it's a sign of strength, a sign of your own strength, that I cannot do it. I'm not perfect, and it's okay to not to be perfect, and it's okay that there are times when I can't do. It's okay that I can. Many times I'm unable to do the task, or I have not done it correctly. So we work on these kind of beliefs in the clinical setup, and that is why they have many times, and many times they have this kind of beliefs, because of which they keep on behaving this way.
So, Dr. Mishra, one more thing. Like anytime have you faced this kind of a situation where you have come to know that actually the women, she doesn't needs to be counseled with, rather the partners or the family members, they need to be counseled, and where
Definitely.
they were going wrong. Any such kind of situation you have
Yeah,
faced?
many of this. Like I said, that mostly from rural part. Many
Okay.
of them. Many of them, and especially in rural part, they need to understand that. And many times I have seen perfectionists, like teenagers, or the teenagers who have difficulty asking for help, or if they fail, so not, or small girls also, where we are encouraging these kind of thing, in the family is encouraging, and where there's a lot of pressure on the female, especially if they are staying with the in-laws, that you have to manage, you are the daughter-in-law, and you have to manage. So where we work with the families, that see, she has developed this because of this, she cannot say, but you can understand that you have to delegate. Many times we do that.
Okay.
So is it taken in the right spirit?
Depends again on the people who are taking, especially the spouse take it, but in-laws it is difficult because they are older. So the older we become, sometimes we become more rigid. So with the in-laws, when we work, it is difficult.
Okay, doctor. We would just like to know, okay, why burnout is normalized in women in our society?
See, burnout per se as a concept, like has come from the in psychology, and in setup, and to say that we have a burnout, we can say as a feeling that it's a burnout, but burnout is a part of symptom. See, it's a symptom of maybe depression or anxiety, like that. So, when people are coming to us, so they are usually coming with anxiety, depression, and some other illness like irritable bowel syndrome, many others like dissociative disorders, and we do a lot of assessment. While doing the assessment, we find burnout and all. And so it is normalized because society also don't know it is burnout. They might be like, I'm overwhelmed.
Hmm.
Burnout as a term. So I'm overwhelmed. I'm like, I'm drained out. Things like that a female will feel. And they themselves, if a person has syndrome, they don't come to clinic saying that this is that. And they come in indirect way, through some physical illness or even mental illness. They will come like that. They will not say that we have this syndrome and we are coming, or we are perfectionists. No, so
Hmm.
they will come with the thing we assess, that why this person has developed depression or anxiety, what is happening in her life, and is it like biological reasons? Many time with biological things also anxiety, depression comes like post surgery and all, or is it something in her personality? Is there something in the environment? Family is like that,
Is
society
it
pressure.
genetic also? Is it genetic?
Many, yeah. All the diseases are genetic.
Okay.
So
Hmm.
many times a superwoman, a woman having superwoman syndrome, the mother might be having also. We have found.
Okay.
I think I would say it is genetic. It could also be environmental.
Yeah, yeah,
I think it,
absolutely. In fact, we say that it's even if it is genetic, we can through environment change it. So we say that it is 30 to 40% of genetic, but still genetic has the power to change if 60%, 60 to 70% of the environment we change. That's
So
the
can
thing.
you give an example of that? I mean, do you have had any patients where you can just share some kind of
And these kind of patients do come who have this, like, we don't call as superwoman syndrome, but we definitely call them type A personality. We call them perfectionist personality disorders. And we find that they have a submissive personality where they have difficulty saying no, because they have a belief that if we say no, then we are a failure, or
Hmm.
people will think bad of us. Things like that is there, and we are seeing them. Of course, if it is depression, anxiety, or all, many times we treat them with medicine
Hmm.
and doing the therapy, where we are changing the beliefs. We are telling them how to set the boundaries. Where this work I cannot do, and somebody else can do, or we teach them how to effectively say no.
Okay.
No, that is called assertive skills training, where we can say no politely, but yeah, putting our foot down.
So
So
is it
this
effective?
kind
I
of,
mean, this kind of therapy, is it effective?
yeah, definitely, definitely, definitely. It is. In fact, therapy, what I call, therapy is when a person is entering a therapist room. It is that I want to change,
Right.
and please help me change.
Yes.
Those who
Yeah,
are
yeah.
not coming, they are, I don't have any problem. I don't want to change, so I will not change.
Right.
So where there is a willingness, so I always say that, therapist work is our work somewhere lies in between where we say I can't to I can. Once they know I can, they'll do.
They'll
So I
start
think I'll just go
improving.
back.
Yeah.
I'll go back to what Sangeeta asked, and
Mm.
also that ties in with something you said earlier, that superwomen are those with the syndrome are looking for appreciation, and that is what drives many of them. So then,
Mm.
if they receive appreciation or recognition in the society or in the family, does it reduce the burnout or the feeling of anxiety, or does it not?
Initially, definitely, that is how they hook on. Definitely, for some time it helps. That's where they hook on. So it helps, but temporarily,
Mm,
because anyway they are doing a lot of work. It is beyond their thing. I mean, we are human, we are not machines. So it will affect their body, it will affect their relationship, it will
mm.
affect their work. So yeah, that is where they hook with. That is where the society also hook. No, you will get appreciation. Husband said you do so well. Wow. Children
No,
say that.
no, doctor, maybe the other way around. Like, you are doing so many things, but nobody is actually recognizing it.
That also
Okay.
happens. That also, see, it depends, because we cannot generalize for human beings. Every human is a book to read. So we
Yeah.
Mm,
cannot say that, so therefore in psychology where the research is basically case study based. If you do, it's not maths.
mm,
So it's every individual is different. In some cases, they are like the invisible person taking the emotional load. Nobody recognizes. Mostly so in rural and small towns area. So that is there.
Mm.
And other sometimes it is also a bait also. So
Mm.
I'm not saying that it's not. It is there. It is there, definitely.
No, I think also we need to understand when we are becoming addicted to that compliment and then getting pulled into that
Mm,
trap even further, and then
yes.
stop it at the beginning or towards the beginning before it becomes addictive.
Mm. So I would like to know about superwomen in the Indian context. So does this manifest differently in small towns and metros?
Yeah, it does. It does because the setup is different.
Okay.
In big metros and all, what happens is mostly it is nuclear family. And then the woman is working, mostly she's working where she has to take care of the family with children, everything, and also take care of the office work. So, and the mostly it's seen that the pressure in metros is basically on how well she's performing, both areas, how well she's managing the family, and how at work wise also how she's doing. And so it's more of a competitiveness, and she has to do manage with the male counterpart equally, and and also you have to manage the house. Whereas in the small town, they have found that even those who are not working in smaller towns, there also there is superwoman syndrome where a woman has to do many things at a time. So if the woman is working in small town and then taking care of here, and there is a joint family there, so there is a pressure from society more. Although basically it is the same, that they have to perform and they have difficulty asking for help and saying no, now I'm putting my foot down. So that is the basic difference is there. But here, more of a smaller town, the social, what people will say, log kya kahenge if I'll say that I cannot manage. So that kind of thing is there. And in Indian context, I would say that we have been shown as Ma Durga, Ma Durga with multiple hands and all. I mean, so we are all the Durgas, but sometimes as Durga also we need to take some kind of break and rest. Even Ma Durga is on the line. sitting on a land. So, so that way, that is the thing. And of course, culturally also, we are being told that, and although that difference is slowly in younger generation is going, we are becoming more westernized than having those Indian values. So, but then when we were young, we were told don't say no, and what others will think, and when you go, then you try to adjust, and so that is all ingrained. Like I said, that all these things are, how we are being brought up in the context of our own temperament or personality.
So
So
then,
both.
yeah. When you talk about this, I think another question I have on a similar thing is, does social media, because nowadays people have exposure to social media and they are exposed to the world through social media. So does it play a role in putting in more pressure to be a
De-
successful or
yeah,
the
definitely. I mean, the social media is like is a yay for everybody, even be it children or adolescents or even male or female. And with
Mm,
female, it's like how this female is managing everything with such work, office, and also self-care. I mean, she's looking so beautiful, she's so thin, and all those things. So it definitely with peer society, and so a lot of comparison, and we
mm,
many times getting inspired how she can do if I cannot do, and things like that. Although we don't know
mm.
what is the truth inside, when time is just how
True.
much truth is there. Yeah, but yeah, it has an impact. It has an impact, definitely.
So now like coming back to our society thing, do you think early marriage or early pregnancy add to the pressure to be a superwoman?
If it is a pressure, it is a pressure. If it's pressure for the female, it's a very individual question. See, if the female can take it and she's can manage it, it's fine. But if it is for her, it is a pressure, not a choice, then it's a problem. See, many
Right.
Mm,
times it's a choice. Okay, I am taking multiple tasks. It is my choice. By choice, I have taken.
mm,
Hmm.
And if it is not choice and there is pressure, then
Hmm.
definitely it's a problematic thing. Early marriage or not early marriage, any work. I mean, see, we don't teach our girls like, it's okay to take a break, and, it's okay to sometimes say, no, I can't do it now.
mm,
So yeah, definitely. The only like you first question you asked, no, the difference between the superwoman and the syndrome. It is this: superwoman is by choice. We all are superwoman, and we are taking responsibility. There is no pressure on us to work or not work to become professional. I mean, uh, especially in the work front. But we have taken it by choice. And when it is too much, then we say, no, I'm tired, I cannot take thing. Please share it, or I cannot do this. But for a person who is suffering from this syndrome, it's a pressure and she cannot take it, and she'll take it, she'll say yes, even if she's not ready. It's a pressure.
Okay.
it is.
So now I would like to know how it affects a woman's mental health if the tendency to be a superwoman is self-imposed or self-driven. I mean, she imposes it on herself. Yeah.
It's both. It's a combination of both. Like I said, that maybe sometimes because it's a personality also. So a person, certain kind of personality has this. In adulthood, if we find there's research being done, where they found that superwoman woman has certain kind of personality traits like type A personality, perfectionist personality. So they have. So there it is self-driven, and it's a combination, and then it's also they have learnt it, society had somewhere while upbringing have pushed it on them. So it's a combination of in fact, type A personalities, they are self driven, they are highly competitive, and they are highly like attend, I mean, they want to perform and get the appreciation also. So many times we become superwoman, just we can't say no just because we want the appreciation. How
Right,
can I
right.
say no? How can I say what people will think? I mean, that means I'm a failure. So these kind of things are deeply embedded in their cognitive, or what we can say in their thought, in their belief systems.
So then, how
So
does
that
it affect their mental health?
it affects. I mean, it does affect not only mental health. physical health also its effect. Many kind of lifestyle diseases now it is coming, high blood pressures and all those things. It boils down to that sleep problem, and one sleep problem will lead to another cascading things like
Hmm.
BP problem or diabetes. In mental health, we mostly see that metro woman suffers from anxiety, depression, which comes from a negative belief self system that I can't do it, I'm a failure.
So, doctor, what is one daily habit you would suggest that would help to reduce emotional overload?
I would say one daily habit we all females should have is to just reflect back for 5 to 10 minutes that what work we have to do, we can do, and what work we can delegate or ask for help or delegate ask somebody else to do it, so that there'll be a balance and we will have time to for rest and delegate whatever we have taken correctly and nicely. And so asking for help, what can we take, ask for, like ask somebody else to help us with.
But
So
here I have one question. Like, I am ready to delegate if nobody is there at the other side to receive it. Okay, then what we should do then?
in that case, they go to a therapist. They develop so you stop. You one thing is when such kind of thing when spouse is not helping. Spouse is not at all helping. The female has come that I have burden, I have lot of yeah. Or even in not in clinical setup, but we see with our work with our colleagues and all. We say
Mhm.
don't do the work. So with our colleagues, like we are working in a hospital setup, so we have other doctors also, we have nurses also. They also many times say, "Oh, what we'll do?" I said, leave it. So many times just leaving and thinking that if I leave, if I do, so prioritizing what work is essential and what we can leave if somebody is not. Leave it. Shopping, leave it. What will happen? There's no vegetable. I cannot. I'm tired.
But does this really work in the practical environment? If maybe it in the office environment or in household also? Okay, I
That
got
is where
what.
there is a kind of abuse happening, no, in the office where they are going beyond the thing. But there also you have to put foot down, or you
Right,
have to take that whether I'll do the job or not, because
See, that is
that's
why,
where the
yeah.
exploitation comes in the office. And they
right.
So,
say, we don't know, you are female, we don't know. You leave the job and go. You have to take care of the house, of the children, you go. And many females have taken break from that. That's because me and my health is important. If I am
I
not
think,
there,
I think
yeah,
when Dr. Susmita said about the younger generation, so this new generation of workers, when office they put a boundary. They're like, after 6, I'm not going to take a meeting, and I'm going to
yes,
leave for home. So you cannot force me to work because these are my hours. So I think
yes.
it's all to do with the boundaries, setting of your boundaries and priorities.
Yeah.
So, Dr. Mishra, one last question. Do you have anything to say to women or girls who carry or feel compelled to carry the superwoman syndrome? And how do we raise our girls so they avoid falling into this superwoman trap?
See, again, like I said, that first thing is to let's not make perfectionist daughters or women. Stop
Yeah.
becoming ourselves perfectionist and tell them to chill. It's okay if you don't get full marks. It's okay to fail even. It's okay. How many of us do that? So when we say that when she's saying, Mama, I'm tired, I cannot do certain things, it's okay. We do involve. Now we are not making them involved. It's the other way around that we are not making them, but we are not making them do any household course, but we are putting them in so many courses at a time that they are overwhelmed, that you have
Hmm.
to do good in sports, you have to do good in like drama, you have to do good in so many things, and there's so much of competition. So they become competitive. This type A personality that if I get good marks or get a medal, then I'll get appreciation, and of course, getting appreciation itself is a reward.
Yes.
That's where we get, so appreciation or winning is a dopaminic thing where we get a pleasure. So we said it's okay. There are times, and they feel very difficult to take failures. Now I'm getting this is the issue with me most of the time with adolescents, that most of them are developing depression because they cannot withstand the failures. And only message for the women or the girls is try to become a superwoman, but we take the cap of the superwoman, be it a cap where you can take it off sometimes that you are not a superwoman. So don't
So
get it
nice.
That's interesting.
stitched
Yeah.
in your head.
Right.
And why it is important is suppose in flights we go, no? So there are when the oxygen is less, there is oxygen mask, I say. So we have oxygen mask, but what they give the instruction that first put your mask, then put. Because if you are not alive, while putting, if you die, then gone. You cannot help others. So put your mask. So
First
take care of
of
your own
yourself.
self-care, of yourself. Then only you can take off the family or the children or other people, or even in the work front.
Yeah, very well said.
I have a
Very well.
friend who says, fill your own cup before you fill others.
Yeah, correct.
Mm.
Absolutely.
Thank you, Dr. Mishra, for giving us so much of your time. This was an extremely interesting discussion, and we have gained a lot of new insights from you. Thank you so
Oh,
much. Thank you
it
so
was
much for
very
coming
interesting
today.
for me
Yeah,
also.
yeah, yeah.
Thank you.
Thank you so much.
Thank you so much.
Thank you. Thank you for your time.
That was a very, very interesting and insightful discussion. One thing I learned from Dr. Mishra is the fact that superwomen and superwoman syndrome are two different but related concepts. And whether you have the syndrome or are a superwoman, taking on this role comes with its own burden, some visible and some invisible. I feel it's probably time to change this role of superwomen and have more normal women all around us. What do you say?
Yeah, I agree. And I think the most powerful change begins when we stop glorifying the sheer physical and mental exhaustion and start valuing true balance. I would
Yeah.
like to say, let's give ourselves the permission to have an easier life, the permission to have compassion for ourselves, right?
Yep.
Yeah.
And you have the power to make your own choices, like Dr. Mishra said.
Yeah.
You want to redefine strength as interdependence rather than endurance. It's your choice. Do you want to do it all, or do you want to choose what matters the most? There is this concept of soft life these days, where women consciously choose ease over exertion, boundaries over burnout, emotional well being over external validation. What do you say,
Yeah.
Madhu?
Yeah, so essentially women need to say, I don't have to struggle to be worthy, I'm enough.
Yeah,
Yeah.
right. Very well said.
For us women listeners, make your choice today.
And for our male listeners, help the women in your life set their boundaries, choose their priorities, and empower them to say no.
Absolutely.
So thank you so much, everyone, for listening and being part of this conversation with us today. We hope this episode gave you something to reflect on and maybe even encouraged you to be a little kinder to yourself. If you enjoyed being with us, don't forget to like, share, and comment. Thank you once again.
Thank you.